I would like to pay my respect to the traditional custodian of the land on which this event is taking place. I would like to pay my respect to the Yogara people and the Turrbal people and the elders, past, present, and emerging. Please let me introduce our two distinguished speakers tonight, Professor Cordia and Dr. Dicky Budiman. Both are from Griffith University, Queensland. I'd just like to read out and share their bio, short bio with you. Dr. Dicky Budiman is a medical doctor who graduated from the Faculty of Medicine, Unpad, Bandung from Indonesia. He's currently pursuing PhD at Griffith University. Dr. Budiman has 24 years of varied experience with the Ministry of Health, Indonesia, Ministry of Planning and Development, and National Health Insurance in Indonesia, and international organizations such as UNDP, ASEAN, and Organization of Islamic Cooperation, OIC. Dr. Budiman has had his significant involvement in various global and national health issues, including SARS, HIV and AIDS, swine flu, bird flu, health missions in conflict areas. He also worked in the construction of hospitals in Gaza, Palestine, and he worked for the United Nations Millennium Development Goal and the Sustainable Development Goals. He's currently a resource person for controlling the COVID pandemic for the Asian region in Australia. Dr. Budiman has widely presented on COVID and other emerging health issues before international media such as BBC and CNN, and has published many articles in international peer-reviewed journal and blog posts in the electronic media. Thank you for joining, Dr. Budiman. Now I'd like to read out the bio of Professor Cordia Chiu. Professor Chiu is the director of the Center for Environment and Population Health at the Griffith University. She has a background in medical anthropology and sociology with expertise in ecological public health, reproductive health, risk communications and community participation, health promotion and integrated health planning. An international consultant actively facilitating the development of healthy cities, hospitals and workplaces in many Asia-Pacific countries, her recent focus has been on building a research consortium for global health security, One Health, disaster risk reduction, climate change adaptation, and sustainable development. Our recent article, The Pandemic and Its Impact, published in the Health, Culture and Society Journal, explored the concept and history of the multifarious impact of pandemics such as COVID on human history. She has graduated 48 PhDs and published over 220 articles and blog chapters and blog posts, and presented over 80 conference keynote addresses. In 2013, she was honored with Order of Australia Award for her significant service to reproductive and public health program. I'd like to invite our first speaker now, Professor Cordia Chiu. We'll take questions at the end of both presentations, both Dr. Budiman and Dr. Chiu's presentation. So keep your questions ready after the presentation. I'd like to welcome Dr. Professor Cordia Chiu.
Very much, Noah. Good evening. Thank you so much for letting me here to share my story with you. In fact, the topic, global health security, is my passion. I'm really honored to be here to talk about both climate change and pandemic under the umbrella of global health security. So this would be the outline of my talk. I would first look at the rising concern over global health security. And then I will briefly present about major challenges ahead for global health security, and with two specific topics. You probably already know it, which is emerging zoonotic diseases and climate change. And then I will talk about what lessons can be learned from COVID response around the world, in fact, to prepare for the next pandemic. And finally, I would like to propose a future direction, one world, one health, and the way to prepare for the future global health security threats. So that's the presentation to begin with. I'd like to mention that human security is its goal always any culture about death and dying and secure. Global health security is about protection from threat to health. And the key message about global is about globalized risk, we share it, and globalized response, and we have responsibility as well. So traditionally, we link to security issue with war and conflict. And so that's the traditional health and security issue. However, because all the year we have gone through so much pandemic, infectious disease outbreak, and that we can see a lot of death and dying and losses. And I think that become a very, very important non-traditional health security issue. So with that, you can see that this particular framework on your left side, the traditional one, and the one to deal with floods and drought and all these are linked to climate change. And on this side is about the health security, but I will focus on emerging infectious disease. Now, with WHO, the definition is global health security defined as the activities required to minimize the danger and impact of acute public health events that endanger the collective health of populations living across geographical regions and international boundaries. So it's really about worldwide strategy and effort to strengthen countries' health capacity to manage our common health threats. Anyway, with the impact of the pandemic, the disease outbreak are on the rise. And now we all live with COVID for quite some time. In fact, it surprised me how long it lasts, and there's still no end in sight. That's really worrying. So the disease outbreak on the rise, so is the social, economic, and impacts. With the health, economic, and social impact threatening from infectious disease, even the tourist industry, many industries will be affected. And this is to give you a little bit idea about the different impact economically from the various pandemics. Now, global health security is a rapidly rising concern for the world. For many reasons, I will explain why. But it has been a rising concern, but now particularly so. And with this, I can really focus on the next point, which is because we are facing two challenges. So it's like dealing at the same time. Sometimes I'm a little bit regretted that everybody put all the attention and resources to COVID and forget about even a larger problem at stake for our children, grandchildren, and grandchildren's grandchildren. And that's sort of the thing. So that's why I like to bring these two together. Then look, basically, the major global health security challenge in the 21st century are those two: environmental degradation and climate change, and emerging and re-emerging infectious disease outbreak, which I leave it to the second part, and then will be followed example by Dr. Dicky Budiman. Now, mounting evidence about climate change impacts already show us how that will jeopardize our common future. There's plenty of evidence to show that there's surging greenhouse gas emission in our human causes, but the growth rate has been really alarming. And we're already seeing some of the impact as shown by those images. And everyone back with many paper and evidence. So in this short time, which I would not go through data with you, give you image just to show what's been happening. Now, this is one of the most famous photos. You can see that the image shows the purple, the red. Actually, if you are in the red zone, you won't be very comfortable. If you are in an even darker zone, you'll be in trouble. Okay, so and if in the 2100, if we have good mitigation, reducing our emission, that means that we only increase 0.8 degree to 2.1 degree. I think we already reached 1 degree already. We hope we will pass 1.5 for sure. If we do no mitigation, guess what the future would be? 2.4 to 6.4 degrees. There's nobody, no animal, no species can live. And that is the picture we're faced with. You may ask, why 1 degree, 2 degree, 1.5? We want to keep up 1.5 and not go to 2. What does that matter? Today, this morning to now, we already probably at least 4 or 5 degree difference. But we're talking about this daily variations about weather. When climate change is about a pattern, usually we need to observe it over 30 years, 20 years, 100 years. It's a pattern change. Therefore, the 1.5 degree means that we will see more heat wave, floods, drought, up to 90% of the reef coral will be lost. And damage to crops and fishery, threats to global economic growth. But if we can keep it under 1.5, not go to 2, then what difference would it make? Well, that means we protect 10.4 million people from sea level rise. And half the number of people would prevent them from without enough water, fresh water. Reduce death and diseases from heat wave, and make it easier to deliver many of the UN Sustainable Development Goals. That's the difference. And unfortunately, from our observation, from the last IPCC report, global warming at 1.5, they don't go over that. Unfortunately, based on the current policies, we could experience global warming more than 3 degrees. We try not to go over 1.5. That's not very pretty. And the reality, this is the GOP 24 December 2018. I will bring you back to the 30-year, 100-year, 50-year. I start in 2018 because this is crucial time that we need to change our way. It's crossroad. So the reality check is not pretty. You look at from carbon dioxide, human activity, Earth surfaces, warming and heat wave, heavy rain, ice has melting, and all this from there is not good news. And the only good news from the left side is that the youth start to participate. They start having a voice. And that, if that's not the right thing for them to protest, I don't know what it is. Something they can look forward to protect their future. Pacific Island, they start engaging conversation because it's about their future. Civil society also coming as well. The bad thing is, in that meeting, we failed to agree to welcome the IPCC's 1.5 report. We failed to endorse it. Representation from the fossil fuel industry have a voice there, a complete lack of ambition for this goal, and Australia promote gas as a climate solution. And Australia is the only nation to join US in a post-coal event at COP24 climate talk. It's not a winner in that sense. Let's see. That 2018 result make time, put the whole issue on 2050, the fight for Earth. So by 2050, the year by which we must have already acted to have any chance of keeping average global warming to 1.5, about 19th century level. And scientists agree, extreme weather, rising seas, swine fire, a deepening refugee crisis, it will be even more disastrous. And actually, this is the first time that Australian Medical Association declared climate change health emergency. And then you can see the young people were there attending actively, hopefully they can be heard. And 2019, this is the time, we are full of activity all over the world calling for climate action. So you can see every month until even December, we have all this activity to prepare going into the next meeting, which is the COP25. And that turned out to be a big disappointment. And so basically, the science is clear, but the science not being heard or ignored. And that is really disappointing. Meanwhile, this is 2019, Australia been burning. So you look at it from April, we already know Australia is unprepared for the coming health emergency caused by global warming disasters, from flood to heat wave, drought, cyclone, and bushfire, and the frequency, intensity, and duration of natural disaster in Australia is increasing. And our health system is struggling to cope. The leading public health expert predicted that. So Australia's bushfire, I think most of you here probably experienced that. It's lasting a long, long time. By December 2019, it has already emitted 250 million tons of CO2, almost half of country's annual emission together. So we also know that it's expected that future heat wave and heavy precipitation events will become more frequent and more intense over most areas. And Japan 2018 declared heat wave disaster because the temperature, because the people have become sick and die. And where else has experienced severe heat in July 2019? Norway, Greece, Canada, UK, Southern California. They always, I think lately, you will always hear the term unprecedented temperature, unprecedented this, unprecedented that. Unfortunately, you're going to keep on saying that a lot. I look at Africa, look at this cold region, cold places in Canada. They suffer from the unprecedented heat wave, but it's going to be more so. So I won't be giving data now, but just the image, acidification, dust sandstorm, forest fire, air pollution, and food security, water security, flood, drought, animal, plant, the environment, they all been impacted. Ice melting, and really, really treasure our heritage statue being destroyed, and migrant worker working even harder. And that's really the kind of thing that we're looking for. Not looking for, sorry, we have seen extreme climate event, global warming, displaced many people, losing their home to go somewhere else, the flood, and we all know it, infectious disease. Now, this is the image that our work and our center deal with. The kind of infectious disease, the kind of heat wave, the sort of work that we need to work with people in this climate-related disaster. But I just mentioned disaster, didn't I? What we know is that even by 2007, we know that climate change will escalate disasters. We're now seeing bigger to the more scale, the speed of disasters. And now, look at our health system. If you think COVID is hard to deal with, just you wait. How much more money? How much more preparation? And Lancet already declared climate change the biggest global health threat of the 21st century. And yet, I would say that we still have people who deny it. Now, that brings to the second point, which is related to your experience, emerging and re-emerging infectious disease outbreaks. So we are in a changing world. The globalization, the people can keep in close context, And that brought with it a burst of new age infection, new and re-emerging infectious disease, and a burst of old and new age infections, the old one re-emerging, such as TB, polio. TB came back with a vengeance. And you can imagine that every hour, 1,500 people worldwide die of an old and new infectious disease. And more than half of these are children under 5. The poor, they are the ones with TB. The Global Fund for TB, HIV, AIDS, you see many orphan maker. And what we see is a pattern. If you look at that, we see when we flow with the year, and more infectious disease. Indeed, 1,400 new infectious disease, 61%, are transmitted from animal crossing species. Of the 175 new infections, 75% from animal. So this emerging infectious disease is actually animal, human, in that zoonotic disease, from anthrax to Zika, Ebola, or the pandemic threat are increasing. So it's not about whether or not, it's when. And this is when now. We were not expecting that to be so long. We know, looking at this region, and their animal and human contact diseases. And we know some are newly emerging, we never know, say novel one, re-emerging and researching, and deliberate. Well, yes, we have met scientists who have deliberately relieved that all by experiment and leaking. So we call this new age of infectious disease. But I want you to look at the right-hand side. It's the environmental, economic, social, scientific changes that have helped to trigger an unprecedented explosion of more than 35 new infectious diseases in the past 30 years. So, and that will be cross mutation. And I would like you to see this cartoon. It's not funny, actually. H5N1, H1N1, H3N2, H7N9, and welcome to the big time, COVID. And that's big time indeed in our time. So what lessons can we learn from COVID response, COVID-19, to prepare for our next one, which may be around the corner? Hopefully, there's not a next one, but I doubt it. So are we ready for the next pandemic? Time magazine asked, and they also answer by the experts saying no. And the current COVID-19 situation demonstrates you're right, just how unprepared the world is for the pandemic. So I quickly want to talk to you about the good, the bad, and the shocking reality that we find out from COVID. The good, wow, the explosion of knowledge. Exponentially, we can get access to big data. We share on the real-time data, enable the world to learn a lot about the pandemic. The bad, that we also overflow with data. In the pandemic, the politics, the confusion, the racism, the inequality, making the world a more dangerous place to live. And the shocking reality, the sick, the deaf and dying, I have never seen in my life in terms of the mass grade run out of space for putting people in. So now that's what I meant, the good one. This is Johns Hopkins. On the day, on every minute, you can see what happened in the world. This kind of sharing data, it hasn't happened before. With this kind of sharing, these are also very good sharing of data and analyze for you. And that sharing of information, knowledge, and real-time data, we can learn so much about for example, the threatening of the curve, the social distancing, see in our own eye, we learn those. Last time, people are not so easily getting those data to learn. Okay, now for COVID, the WHO directives say we must act now to help countries prepare for that possibility of pandemic. This is before that. They say time for fact, not fear. not rumor, solidarity, not statement. Well, what have we witnessed? Country ill-prepared for the pandemic, health system cannot cope, lack of basic equipment and supplies, masks, PPE, ventilation, medicine for treatment, and endangering health worker, social unrest, fear, panic buying, hoarding, misinformation, confusion, rumors, and infodemic, increasing division, racial discrimination, scapegoating, violent behavior, domestic violence, for example, a more dangerous world to live in. So we are fighting two pandemics, maybe infodemic or the other discrimination and the pandemic. And you can see the race is just beating up people and fighting for toilet paper in the supermarket. And well, we have our leader conversation. You can't send astronaut to the sun because it would burn. And we have our leader who's very popular still now. What if I send them at night? Well, would they burn? Anyway, that's the ugly reality. Look at the red, look at the purple, look at this. But what really happened is we have vaccine. How long now? We all say, wait till the vaccine, and it will solve our problem. The end is not in sight, I can guarantee you, because right now we're still climbing. The country that had high vaccine rate is still climbing. Australia in August had the highest climbing rate. And US, the rich and the mighty, they still. See, this is the global figure. So let me just show you what I want to sum up 3 points for you. What do we learn? We learn what we can confirm. That is the proven public health method that worked, still working. And that's what protects us. And then contrasting to what we believe, I can show you now, we believe capacity and health security. No, contrasting to that, new discovery, the importance of leadership and communication for the success or failure of a pandemic response. That's new. Now, what do we mean that by this? These are the traditional methods. Getting better and better. We still need it to be better. But these are the things: risk assessment and comprehensive risk management, early intervention, mitigation, preparedness, rigorous testing, use the latest IT technology, the room to go dispersed cloud, for example, contact tracing. NOAA is now the world leading in that. And hygiene measures, physical distancing, and social restriction, and risk communication as an integral part of risk and crisis management. So that confirmed, we still rely on that to save life and livelihood. And those are proven public health measures that sometimes people don't think is science. Every dollar people have, they invest in maybe vaccine. I'm not anti-vaccine, I actually like it, but I'm thinking you don't put everything in one basket because that is not good enough at the moment. These traditional guidelines are still good. And what we have learned is that our, like Griffith Health, for example, they're using much more simpler statistic, graphic, explaining so clearly, so easily accessible for people. So that's good news. And the planning out with moment about COVID safe, look at that, what's changing? Step 1, 2, 3. All these plan out, important. Not many countries do that, I can tell you that. Now, this one is what is contrasting. It blew my mind. We have a global health security index score. America, number 1, the most secure. UK, and Australia is in the 3rd tier with Canada and so on. And then China's out there in the middle, and India also is in the middle. So that is according to the Global Health Security Index score. What happened? Well, on the top is not the high security, it's the one who died the most, who had the most spread. Okay, so who are the countries? US, India, Brazil, UK. And Indonesia is not too good either. Israel, we held the best vaccine rate, must be good. start to open up. Guess what? It started to climb again. Okay, on the right-hand side, we have a province that is 58 million, they have zero death. We have, we look at Australia, totally nearly 100,000. And death, 1,000. That's too many, but better than a lot of other countries. We're lucky. Victoria, New South Wales, and look at Queensland. Queensland, totally 2022. We actually only have 5 deaths according to Queensland Health because 2 have died in New South Wales. It's Queensland. Okay. So New Zealand, total confirmed, 27 deaths. Now the world actually, you can see that those are the good performers, supposed to be the top performer. Global scale, see that they're the good one. How come they end up in the bottom? What's the problem? So now emergency management, I just want to briefly say there are several phases. Mitigation, preparedness, response, and recovery. Each phase actually emphasizes planning, coordination, and communication. And if you are talking about the whole of society approach to pandemic preparedness, you still need coordination and communication. And done well. So in this communication means that help you to cope with the unfolding public health emergency better to help the stakeholder, the community define risk and helping to promote community resilience. And that's now we understand that risk communication already been proven that should be central to the whole process of risk management of pandemic. And they should be helping every bit, helping the risk assessment, helping the risk management, and helping all this part to end. You can see that there are principles developed. Already many publications show this that work. Like develop trust, transparent, making announcing early, listen well, plan well, be honest, frank, and open, be empathetic and caring, accept and involve the public as a partner. That need the leaders to do that too. Do we have that? Well, these are the paper with data to show. If you compare SARS-1, SARS and N7, H7N9, risk communication help at H7N9, which is more deadly, to have a better response. And I won't have time to show you the case study of the data, why. So compare those two, definitely will show how the risk communication can help. And it's not without booklet and guideline. Look at that, 2 of it. These are guidebook. Did we use it for COVID-19? No evidence, except for those who do well. So you can see the government COVID response have learned from past good practices, particularly regarding the need for comprehensive risk management, integrated with a risk communication strategy for pandemic response. Very little evidence. And actually that brings you our new discovery, the third point, final. A new discovery is that what COVID-19 has shown is the importance of leadership for the success or failure of a pandemic response. It's actually, everybody now can see if there's good leader, it must be strategic, decisive, calm, goal-oriented, critical thinker, clear communicator, ability to prioritize, and somebody have a heart. And, well, that's good and bad. So you can see the differences. So the means leader also need to understand the 5 key principles of risk communication. And we do find some good example. People will agree that just Jacinda Ardern is one of the good leaders. She can sustain the confirmed and then the COVID confirmed cases looking good. And I would like to propose to you, we have one even do better. Queensland actually have a bigger population than New Zealand and only 5, that or maybe say 7. She's that young. Who's going to be our governor? She actually is one what we see is the leadership, public health leadership. And so these are the ones who have good leadership, bad leadership. This one and this one. Well, can't be afraid of COVID. Don't let it dominate your life. And this is the editorial saying, here in the United States, our leaders have taken a crisis and turned it into a tragedy. And India and Brazil, don't be a sissy. You will die anyway. Okay, this three. Let me just ask you what we learned. What are the something in common? They have repeatedly dismissed and downplayed coronavirus. They have ridiculed public health guidance such as mask wearing, and they have put out false statements about pandemic. Those are in common. So to finish, our outlook, long-term risk outlook is still not looking good. We have an elevating health inequality today. We have to stop infectious disease preparing for a pandemic. We know the driver. What if going to be repeating wave? What are we going to do? Climate change and health, very important. That means the three pillars of the infectious disease outbreak will require the fourth one, which is climate change adaptation to better prepare for the future. For global health security, we need global partnership, which means we need to work on what we call a One Health approach, which is collaborating effort of multiple health science professionals from different fields to work with animal, environment, and infectious disease and people under the One Health umbrella with different disciplines, and One Health, One World. And we are actually here, we are the whole world start to link, and we start having One Health Day on November 3rd. So One Health means global partnership and different partners working together, and leadership and risk communication are keys to facilitate a One Health approach to prepare for future pandemic and safeguard global health security. Thank you.
Thank you very much, Professor Cho. Very interesting and enlightening presentations, lots of data and information. And I would like to invite now Dr. Dicky Budiman to continue to his topic presentation. Thank you.
Thank you. Good evening. Okay. I will try to make my presentation short, and my presentation will be more based on the actually my research on this PhD is about the leadership and risk communication, especially during the pandemic COVID-19, which is deeply involved for the Indonesia specifically. Can COVID-19 show why poor risk communication and poor leadership must never happen again? This is very important, and this is Indonesia, as we seen then. And for sure, the number is still underreported. And the public health and public relations is very important. This is two sides between the leadership and also the risk communication. And the aims, of course, to improve the health outcome, and of course, then the influencing and engaging and reaching out the different risk audience. And also the aim of public health leadership during pandemic is to also to influence, the inspire, and also the contribute toward the effectiveness and success of the vision and goals of the leader and country. Of course, during pandemic, we have the significant uncertainty and require rapidly adaptive response. And that's why in my research also I compare the principle of both this communication and also the leadership. And this is based on the leadership one based on so the many literature, and also for the WHO. Even my partner Ruchi also have this principle of the leadership. I mean the risk communication I try to refer to from the WHO. And then there's an intersection between both the risk communication and leadership. Transparency, of course, there. Trust, Professor Cordia already mentioned what he said, and also the creative and coordinate, visionary, and also the last one, the sign driver. And those intersection I look at in several leaders in Indonesia. On this opportunity, I will show you some the example, the good example, because Indonesia now is in very sensitive situation, and as the one who really involved with this, I should choose the wise example for us for tonight. Indonesia timeline is as we see from the slide. We have this denial and false information from January to May of 2020. There's a lot of story during that period. I'll just mention. Professor Cordia already mentioned about the don't play the leader, don't play. But what I mentioned, the leader is not only about president, it's many leader. And when we talk about the public health leaders, so including the institution leader, the public health leader, it's been also the hospital leader, and let's give the long impact to the community, because then we show that even now many community also even the local leader also still have this wrong, wrong opinion about the COVID-19. And we saw that also that started from at least end of last year. Many people, the many leaders started to change their opinion, and they started to follow the science, basic science to respond to the pandemic. Unfortunately, the law of biology is they never wait people who become right first and then they become a problem, because then as we saw from the curve that Indonesia already have now two wave, and that's why I put this overcoming now. Yeah, here. Every day I'm in media, in TV, try to remind the government, try to remind the many leaders that, because this, I believe one of the Lancet article also mentioned about how overconfidence can put the country in danger. That's now in Indonesia, and because they feel they can manage the COVID-19, and of course for some part like here, this is I choose some example for my intersection issue between risk communication and leadership. The trust and transparency, the competence, confidence, compassion, and of course the last one, consistency, is already solved by Jakarta, the capital city, and the leaders is Anies Baswedan. Again, in Indonesia, when I talk this, it's very sensitive because she's the one who become the next candidate for president. So it's very complex situation. When we talk about this communication, you have to to choose wisely, and also to look at who is your audience. This is not an easy example, but this is good example for us to, because then we can deal with the next crisis. And also the other intersection is about the communication. Of course, it should be clear and also not only about the point, but also about the flow, the interaction, the efficient, and also useful and benefit for others. This is just the last release news from the government. Of course, Pak Jokowi is the one also who now, I mean, maybe started from the mid of last year. He become more strong in terms of following the science and also listening the many experts about how to deal with the COVID-19. But then, as I mentioned before, the leader is not only one. And then we can see from here that when we talk about the creativity, Indonesia is very huge. We have, compared to Australia, Indonesia has many islands, and each island has their own curve, their own problem, and their own challenges. And that's why they become the local leaders should become creative and also visionary, because otherwise people will not follow their recommendation or advice. And the other also about the empowering and coordinate. And this is the issue that I found during my involving with this process, that the provincial government in Indonesia, we have decentralization scheme, and it put provincial in very weak position because they don't have enough authority to support or to inform. They just like represent the central government. This is something that we face during this pandemic. And of course, also in the other side, the district level, not all of them have this capacity to deal with the pandemic. And the good thing from, I have to come back to this. The good thing from this issue, the central government, actually I advise the president that you have to have the top-down strategy to have the district, and then they have now, we call it PPKM, or the large social restriction, because before we have PSBB, or PSBB is like social restriction, but come up from district. But then every district has their different, they have different capacity. And it's become, inequity, and there's another problem with it. Okay. Then the other intersection is also the proactive and science drive. So these three of this is not on purpose, but this is the example from the media. But was Sandiaga Uno is the minister, and Ganjar, the governor of the central government, and actually three of them are now become the very famous leader in Indonesia for the next presidency. But the good thing from them is that they follow the science. They follow the science and become proactive. Let's say this is Ganjar strategy or proactive. And he came to the we call it kampung or village leader or local leader. He gathering them and have these regular meeting with them and listen from them what is the current challenges they face, and also directly give them the instruction. This is what he had strategy. And the other, this is my last two slides. The impact, this is one of the examples of the impact of poor leadership. I'm sorry I didn't put the region or district or provincial here because too sensitive. The result was the information and policy gap that left the public desperate about this issue information that the result. And also the impact, the other impact is about because not enough source for the information. So the news, the media has become their main source. So that's why the many like me, let's say on TV I can like live 5 times a day, and also regardless of the other media. But this is one of the examples that how hungry they are in this information. And my last slide is about the just some of the conclusion during just up to now. The lesson learned from up to now that communication is the heart of the relationship. And every action, everything is about communication. When you talk about the how effective Jakarta about the vaccination program, it's about how effective they send this communication. And when we talk about Ibu Khofifah Gubernur in East Java about the tracing and testing, it's about the how she can deal with this conservative Islamic community. It's about communication. And I can talk long about this, but having decision leadership with a dynamic team is also very important. The Jakarta governor, Anies Baswedan, told to media that he has Avenger teams. It's like Avenger teams. So this is how important to have this. And the complexity of the national public health practice, of course, this is will require the rapid evolving of the response. And I can see that the many leaders now learn about to make a decision, balancing this decision. And last point from this lesson learned is that in time of crisis, leadership and accountability is go hand in hand. Otherwise, in many districts, we found that the public doesn't want to follow their leader recommendation or their leader program because it's about accountability. That's my last point from this presentation. Thank you.
Thank you very much, Dr. Budiman. A good experience to share from Indonesia. Leadership is very important, as you have seen all the big crises, how the leadership act and how the followers of the country people they follow and all the consequences. Sometimes the leadership takes the decision, but when they fail, they don't take the responsibility and they put their blame on others somewhere else. So it's a very good presentation. So now we have got about 5 minutes or less than 5 minutes. I'll just take a few quick questions. First, we'll take questions from the floor. All right, so let's start from the front.
I just wondered, when we're talking about climate change and medical effects, I'm wondering, there are specific events like floods and drought and fires which cause medical events, but is there a problem where general shifts in temperatures in climatic zones cause animals to move and cause a greater evolution of new type of animal-derived diseases or others?
I think a very good example would be the climate-sensitive mosquito, which they spread. Like malaria, we have a different way of spreading, is a parasite. But dengue, surprisingly, they now already climb to Himalaya. Before we have travel warnings, say pregnant women under 2,000 bottom, but it's not. It's over 3,000. They have got, because their life cycle is only 1 month. They can mutate much faster. In a competition, they do much better. But there are some simple public health strategy. If the larva is not allowed to survive with a lot of water, then that's it, right? But that's hard, because that means that everybody had to do something. And then also, maybe that means that if the money will go to the genetic engineering, it will go there. And then sometimes undermine the local proven method. It's the same. Anyway, go back to your question. Yes, animals do migrate and they cross species. When you cut down their forest, when they cross species, they become some new thing that we have hard time to do.
Okay. Thank you. Thanks, Tim Solomon, Professor of Medicine, and thanks for the talks, thanks for the lovely slides. You mentioned, and I think Lance would probably agree with you as the editors, that environmental degradation and climate change are two very major problems. So I'd like you to comment on the fact that during COVID, for the first time, we've had a really large reduction in anthropogenic CO2. In fact, it's been worldwide about 5%, perhaps a bit more, perhaps with the exception of mainland PRC China. What's the effect of that in terms of climate change? Obviously, there are some benefits as well as negative impacts. The second thing is that since COVID, which is a major pandemic, there's been a huge increase in bio-waste, once use only, and you've talked about environmental degradation. What's the effect of that? What do you see about that? Go on, but two questions I'd like you to comment on, or rather expand on. Yeah.
Yeah, what a great question. That is really good. I'd like to answer the second one first because it's a thesis of a PhD student about bio-waste, about the hospital waste during that time. And it's just even simple, we used to our own cup. We're not allowed to use it anymore. We have to use another cup. So it's actually created a situation that we have to reverse to our practice in the past. That was not environmentally friendly. Now, COVID reduced air pollution in China, many cities. So when I sort of review publication, they often say, oh, this reduced and that reduced. They don't make a point that this just go to show that if we have an effort to strategically reduce this kind of emission, then you will actually have the benefit of the health. Rather than saying, no, we can't lock down all the time, so this is not a solution. The solution got to be there, just not about lockdown. It's about what to replace, what to improve, and what to the whole 7 step about installation and so on. We could actually deal with that. And then I think that question needs to be asked now, because it's now tiny. COVID is still a lot of places, their traffic is getting better, and people's asthma are getting better, all this. That means another way of showing, demonstrating the effect of pollution to health. So, but how to deal with not locking down in order to get that effect?
Exactly, how to do it. Yeah, exactly, without COVID.
That will be, you can persuasively not using that as a case, but you have to give them technological solution.
I think we are running out of time, so I would like, if any other questions still have not been answered, so would you please forward the questions to Dr. Cho or Dr. Budiman afterward by email.
Look, thank you, Dicky. Thank you, Cordia. Look, things aren't great, but you've actually lifted our spirits tonight. So, so thank you. And the message is follow the science. Yes. Well, COVID or no COVID, pandemic or no pandemic, AWA Queensland is powering on, and we have a very full program of events coming up. October the 5th, with COP25 looming, we've got Australia and climate politics, a perfect storm. The question is presented by Associate Professor from UQ, Matt McDonald. October the 12th, we're back to COVID and with another very high profile person that Nora's secured for us, Raina McIntyre from the University of New South Wales and the Kirby Institute. She's going to be talking about COVID vaccines, variants, and the post-pandemic future. and hopefully we've got one. October 19, and this could be a little hopeful, but we're looking to have an AAAA get together to get people back out. People have been staying away because of COVID. Hopefully the situation will have cleared a little bit by October the 19th and we can have a social function here. And finishing off, well, not quite finishing the year, but November the 9th, we've got a very distinguished speaker. That's University of Queensland Chancellor Peter Varghese, AO, who's a former DFAT secretary. He's going to be talking about Australia and the shifts in the Indo-Pacific with the Quad and the rising tensions with China and AUKUS. What a wonderful sounding opener that is. There's going to be plenty to talk about. So AAA Queensland, plenty to see. Have a look on the website. We'll be sending out plenty of messages. And lastly, Dicky and Cordia, you are members of AAI Queensland for the next year, and hopefully we'll see you at some of our events. And thank you, and good night.